Yes, well, I'm Anna Godoy from the University of Lincoln. It's a similar study because in both studies, and the one we presented at the beginning and this one, we look at the link between bisphosphonate and risk of stroke. But in this case, we did a matched case control analysis, and the ones I had presented before, it was a case use analysis. And actually, this study was done before the other one, but for some reason it was put before in the program. But it's all right. That's right. So, a brief of introduction, to talk more about this. Just to say that a high proportion of people in the UK are suffering from osteoporosis, with a prevalence of the disease that increases with the age of the patient. Osteoporosis is being treated with vitamin D, calcium, or bisphosphonate, and there is concerns about the association of these drugs with cardiovascular diseases and stroke among them. For calcium and vitamin D, it has already been shown that they increase the risk of cardiovascular diseases and stroke. However, for bisphosphonate, this evidence is not that clear, and there are some studies showing a small risk, and there are some studies not showing any risk at all. So we want to see that if there is any link between the bisphosphonate treatment and the risk of having a stroke. In order to do that, we did a matched case control analysis for which we used a one-to-one matching, where one case was compared with one control, using age, sex, calendar time, and practice as matching variables. The study period was the same as Shahid presented before. It was from the 1st of September 2001 until the 31st of August 2009. We did both the unadjusted and the adjusted analysis. And for the adjusted analysis, we include as confounders the disease risk groups associated with a stroke, cardiovascular risk factors, treatments, GP consultations, home visits, and deprivation, for which we use the IMD score. So what did we find? We had more, among the cases and the controls, there was a high proportion of people under the cases taking bisphosphonate than under the controls. And from these people taking the bisphosphonate, the majority referred to females, which is normally the ones that are suffering more from osteoporosis. When we included all the variables that I mentioned before in the analysis, we obtained that the odds ratio was equal to 1. So we didn't find any association between the bisphosphonate treatment and a stroke. So we could conclude that bisphosphonate might be a safer alternative for the prevention of osteoporosis in people at risk of stroke, as Shahid showed before. Thank you.
Chris. I'm surprised you can separate out bisphosphonates from calcium and vitamin D treatment, because I had thought that the recommendation was to always combine, or at least ensure people have vitamin D repeats and adequate calcium intake, which can often mean that they are co-prescribed. But you evidently found lots of people were just on bisphosphonate.
Yeah, like we did, how it's called, the Venn diagram, with those people having only vitamin D, only calcium, only bisphosphonate, and there were different numbers. So there were only people on their bisphosphonate prescription, others only on the vitamin D prescription, others only on their calcium prescription.
Just to say, it's a relief you've got the same findings.
Especially because we are doing both the same analysis.
I was thinking, what would you have done to ensure?
Yeah.
Did you have similar power to share between the two studies? Which would have been the most for your type of analysis? In terms of statistical power, to be sure that your results are the same, do you think are your results, how do your results compare in terms of statistical power?
I think both.
Yeah, I think we had 80% power in that, so statistically it was fine. I think the analysis was better.
So we can be pretty clear.
Just another point about the issue around co-prescribing. The analysis takes into account co-prescribing because it adjusts for
within the confounders we have all those variables.
So that was the other thing that we looked at.
one of the components.
Okay.
Yeah, we're in the treatment.
Thank you very much.